And we need to have a sense of responsibility for our health more than ever. Hello and welcome to this edition of the Wise Medical Minute. Today's topic is a little different from what we usually do. I wanted to emphasize, in the spirit of preventative health care, wellness by the numbers. Now, once upon a time, we spent a lot of time talking about annual physicals, but the truth be told, with all the uncertainties in healthcare coverage and all of the things that have happened to keep things, quote, cost effective, there really isn't much of such a thing as a proper annual physical anymore, and even the people performing them don't really know how to do it, but that's another topic for another day. But anyway, therefore, it behooves us all as healthcare consumers to be a little more involved with keeping track of the pertinent data regarding our health. So the easiest way to do it is being aware of certain values for things like lab tests, and being aware of things like a healthy weight, healthy body fat, and all the stuff we're going to be talking about over the next few minutes. I'm not denouncing the value of an annual physical exam, but because of the interference by the insurance industry and the government, the annual physical exam has deteriorated into an exercise in ordering a few tests. And because there's so many doctors out there doing all of the routine labor, no one actually does a proper exam anymore. So because such services have such limited coverage, it has become diminished in its emphasis, not in its importance, but diminished in its emphasis in the healthcare communities. And in Georgia and several other states, you can actually go into places that draw blood or collect urine, and you can order your own lab tests. So in that spirit, I wanted to emphasize the things that most people should be familiar with in terms of preventative concerns and good health care. Now, the obvious one is height and weight. We've talked in previous videos about BMI. A healthy BMI is between 20 and 25. I like to make things simple. When you look it up on the internet, you're going to see some decimal points before and after those numbers. But I'm going to give you a whole bunch of numbers today that you can carry around in your head. So BMI needs to be between 20 and 25 to consider yourself healthy. Quick calculation. You take your height and weight, then you take the weight in pounds, multiply it times 703, divide that by your height in inches, and then divide that number by your height in inches again. And if the resulting number is more than 30, by definition, using medical criteria, you are obese. Healthy, again, is between 20 and 25, roughly. And when it gets above 40, it actually has actuarial implications in terms of shortened life expectancy and all kinds of not so good things. So that's a number that you need to be aware of, your BMI. Now, more reliable than BMI, because sometimes people have increased muscle mass, because some people, are just by design either more slim or more muscular. The BMI only considers height and weight, so it's not as reliable as some other parameters. The two I like to stress are the waist-height ratio. We used to talk about the waist-hip ratio, but especially for women, that one is not as reliable. But the waist-height ratio does correlate with percent body fat. So we want to start measuring your waistline in inches. Again, divide that by your height in inches. And if you're male, if the resulting fraction is more than 0.54, you're overweight. Okay? For women, obviously women are supposed to have a slimmer waistline. You divide the waistline measurement by your height in inches, and that number should be less than 0.48. So get familiar with your waist to height ratio, and that'll tell you about, correlates with, I should say, your percent body fat. Now let me shift to talking about percent body fat, because that's not as easy to get measured, but even in places like a gym or personal trainers and in certain medical offices, you can get your percent body fat measured, and you can't have zero fat and be healthy. There's something so-called essential fat. For men, that's in the range of 2 to 5%. Athletes tend to be in the single digits up to around 13% body fat. That's real serious athletes. Healthy for men is between 14 to 17%. And when you get above 25, in the 18 to 24% body fat is acceptable for sedentary people. Above 25% body fat, you're obese. Okay? So if you're able to get access to a measurement of percent body fat, that's another number worth monitoring that will have health implications. Now for women by design have to have a higher percentage of essential fat that has hormonal implications and has to do with things like reproduction, and what's considered healthy for women is more in the range of 14 to 20% if you're really athletic, and acceptable for a woman is up to 25 to 31%. So for women, when it gets above 32% body fat, you're obese. So we want to find out where your percent body fat is, and that requires measurements that are not always convenient. People do it with skin fold calipers, not that accurate. Immersion into water basin and measuring it that way is a little more accurate. The DEXA scan, a whole body type of x-ray type of thing, is the most accurate. None of those are convenient. Therefore, we use the waist to height ratio, which tends to correlate with percent body fat, and that's something that you can measure and monitor pretty easily yourself. Now, I wanted to get back to the things that come with various lab tests. We always look at things like your cholesterol. A good cholesterol, and there's even home kits that measure this stuff now. You can order it online. We want the total cholesterol to be less than 200. There's good cholesterol and bad cholesterol, and nowadays there's more sophisticated ways to measure lipids, so we don't talk about that as much as we used to. But the lethal, or LDL, I call it, bad cholesterol, we want that under 100. And the healthy cholesterol, the HDL, or high density, that lipoprotein number should be at least in the 40-50 range, up to 60 is good. The higher the better. I always tease people when they come back with numbers in the 90s that you're going to live forever, but that's not true. But basically, the HDL, you want it as high as possible. Exercise, hormone replacement therapy, and lots of other things will naturally increase the percent of the good cholesterol, along with some dietary factors we'll talk about in a future video. But I'm not a big fan of pushing the drugs that lower cholesterol, because we're getting mixed reviews on whether it helps with things like mortality or cardiovascular events. I think that the lowering of cholesterol for people who've had a cardiovascular event is more important, but for just ordinary healthy people and the numbers are borderline, marginally elevated even, sometimes the treatment can get worse than the disease. So I would exhaust lifestyle measures before getting into drugs for managing your cholesterol. Now let's talk about blood sugar. Blood sugar is something that can be measured yourself at home with finger sticks, but they even have fancy gadgets that you don't even have to stick yourself anymore. We can talk about that more if you like, but the number that I want to carry around in our head is the hemoglobin A1C. Now, That reflects how your sugar was over a preceding 12-week period of time. And I was doing screenings using that parameter long before it became cool. So I've been looking at A1Cs for 20 years, and over that period of time, I've observed that the normal values in the laboratory have crept up. It used to be normal was up to 5.5, and it went to 5.6. Now everybody's saying up to normal is 5.7. The definition of diabetes hasn't changed, and that's been when that number reaches 6.5. So the thing is, once you reach 5.6, say 5.7 to 6.2, somewhere in there, they like to use the label pre-diabetes. I'm not a fan of that term either, but in that range, I like to make a diagnosis because the process that is diabetes is already present. You just haven't roasted your pancreas yet with Twinkies and sugary beverages. So I don't think it's necessary to wait until half of your pancreas has rotted to make a diagnosis of the process that's present when your sugar numbers are averaging in the mid-5s or higher, because they don't diagnose diabetes because it has to be up to 6.5, which correlates with blood sugars already over 200 most of the time. So the average blood sugar does not have to be measured fasting, and it reflects how your sugar is 24/7 for 12 weeks. So that's the value of the hemoglobin A1C. And we want that number less than 5.7. Everybody needs to know their A1C. Now, I don't want to focus on numbers for vitamin D, but new data is out saying we need to be more aware of our vitamin D levels, and or if you're a healthy person, just supplement it. Every time I measure a vitamin D level, even in very healthy people, 9 out of 10 literally are abnormally low. And probably that means we're not ordering it enough. But the bottom line is, for healthy people with normal healthy liver, normal healthy kidney, supplementing it isn't going to hurt you. But especially coming up on the wintertime, when you're not outside getting enough sun, supplementing is worth doing because it has implications as far as our immunity. And I mention that because of things like the COVID pandemic and the flu and all of the things that depend on our body's own immune system to recover. Coming into this season, I think it's reasonable to supplement. And the number I want to leave with you is 600 international units supplement daily. Now, some people feel they need more than that. There isn't such a thing as too much. So when you get above the 2,000 to 4,000, depending on whose book you read, international units per day, it can actually become toxic. So for people who don't get much sun, or for people who are relatively sedentary, people who don't eat dairy products or drink dairy products, that is even more important than routine to supplement the vitamin D. Measuring the blood test, different labs report it different ways, so I won't bore you with those numbers. But if you're healthy and you don't get a whole lot of sun, 600 IUs per day, supplement. Now, we didn't talk about blood pressure and pulse. Now, that's probably as important as anything else we've discussed. You can measure your own blood pressure at home, and the normal values changed about 10 or 15 years ago as far as target for well-controlled in people with high blood pressure. But so-called average is around 120/80. Above 135/85 is considered elevated and not well controlled if you're hypertensive. So that's another set of numbers that you need to be familiar with. When you measure your blood pressure, you want it under 135 on the top, under 85 on the bottom. So that's a number that everybody should be familiar with as well. Now, heart rate's a little more difficult. Pulse, heart rate, your pulse beats every time your heart beats. So those numbers should be the same. When they're not the same, that has medical implications, but we won't get into that. But for your pulse, which you can measure yourself, So-called normal range is between 60 and 100. A lot depends on your state of health. If you're, in good physical condition, good cardiac activity, and numbers tend to be on the lower end in the 60 range. When you're, let's say, deconditioned, that number is going to be closer to 100. If you're exercising, we want it in the 80, 100, 120 range even. And that's formulas based on your age that I will not bore you with now. But that's a number where if at rest, when you haven't been exerting yourself and you're seeing a pulse of 90 to 120, that's worth an evaluation. When you're exerting yourself, it's going to go up, but recovery time is another way to assess fitness. If 5 minutes after you exert yourself, it's still over 100, you're out of shape, number one. But number two, there may be a need for more thorough cardiovascular workup before you go overexerting yourself. So heart rate's another number that we should all be familiar with. Let me switch channels here. In previous videos, we've talked about male hormone replacement therapy. And having seen the benefits thereof, I think that's another number that even young men need to be aware of. I'm amazed at how frequently when people have vague symptoms of loss of energy, difficulty sleeping, just not motivated, they always worry about it when they can't perform in the bedroom. But there's lots of other general wellness kinds of symptoms that correlate with a low testosterone level, especially when people are also overweight or relatively sedentary or on certain medications. So the numbers range, it again varies by laboratory, but they consider around 300 on the low end normal, and the normal range can go up to 900. However, some labs go up to 1100. I don't like those kind of numbers. And some people go down to 250. I don't like those numbers either. But when people have low numbers under 400 and they're having symptoms, I do think it's worth at least thinking about treatment. So the target number, and the number to carry around in your head if you're a male and, under 50, 60 years of age, you want your testosterone at least 500, 600, and you feel better if it's higher, but it starts creeping up close to the 900 mark. That's when guys start doing stupid stuff, putting your fist through the walls, kicking dogs, road rage. So we don't want it too high. But when it gets too low, there's issues with things like memory, sleep, energy, impotence, etc. So we want good numbers, and that's a number that more men need to be aware of. Now women, a lot more complicated. You got to measure multiple hormones, and the range varies too much by age to have a fixed number to just leave you with. But suffice it to say, especially after the age of 50, there are health benefits to women having normal estrogen levels as well. We'll talk in a very near future video about female hormone replacement therapy. We do a lot more than that for women than men, but we've had a recent video on male hormone replacement. I need to do an updated one on female hormone replacement, so we'll talk more about numbers in that video. Those are the important things I wanted to do. I'm going to limit the numbers to things that pertain to most people. So obviously if you have specific medical conditions, you have genetic issues, obviously there's some more numbers unique to yourself that you may want to become familiar with. So ask your provider, and that's another word I don't like, preferably ask your doctor what your specific diagnosis is being monitored with in terms of lab work and what kind of target numbers you should maintain. And we need to have a sense of responsibility for our health more than ever, because every time you go back to your primary care physician these days, you might see a different face. So for that reason, in most circles where they're focused on billing insurance companies and not taking care of patients, you have no choice but to take more responsibility for your health care. So with this kinds of information, you can do a lot yourself to make sure your provider is doing what they're supposed to do by making intelligent requests. That's it for today. Thank you for your attention. Thank you for the time, and I solicit your input for future videos. So you can write me at info@wisemedicalcenter.com. I don't tweet, and I don't YouTube, and I don't do all those other things. But I have people putting these things on YouTube for me. But if you want to get directly to me, old school email is the best way to do it. And I will reply, and I will incorporate your thoughts and requests in future videos. Thanks for your attention, and we hope you'll tune in and subscribe to the Wise Medical Minute.
Thank you for listening to the Wise Medical Minute with Dr. Thomas Locke. Dr. Locke addresses current events as well as important medical issues using responsible, unbiased journalism approached from a medical perspective. We invite you to submit questions or comments or suggestions for future topics by email to info@wisemedicalcenter.com. Again, thank you for viewing the Wise Medical Minute.